Hello everyone and welcome to, today to this audio podcast. This would be the sort of a final audio podcast as part of this this premiere. This audio podcast is an audio podcast as part of the Serology and Squil. This an audio podcast as part of a hustle and stereotype. An audio podcast as part of a Defcon premiere. And this audio podcast as part of a Storm Robotics production. So in conclusion, and as part of works or some works in looking at an exposition on stratified receptors, the idiosyncrasy surrounding early transplant immunobiology, and looking at this from a particular sort of immunobiology, a particular sort of immunobiology or immunology perspective, so to speak. So in conclusion, there are several mechanisms to help patients or healthcare service users and healthcare professionals take a greater intrigue in the scientific aspects of solid organ transplantation, in the sort of scientific aspects of solid organ transplantation, and some of which have been implemented. Allied healthcare professionals, or AHPs, and healthcare scientists could be encouraged to be more constructive. Could be encouraged to have more sort of constructive dialogue with MDT, multidisciplinary team colleagues, and it is a responsibility of all healthcare professionals to provide the public with new knowledge, thus bridging disparities, and social determinants and aspects around social determinants of health. Additionally, investigations in the role of chemokines surrounding AAR research is still challenging. Primarily because healthcare professionals that could offer, for example, educational support through integrated PPI centric services and MDT involvement for healthcare service users have not been part of the thinking, either the thinking or the actual sort of implementation of healthcare services in primary and secondary or secondary care healthcare services, in context of sort of mainstream practices or healthcare practices either. And so PPI to help understand where healthcare service improvement and enhancements are needed, are still main when it comes to to integration and joined up thinking. Work surrounding the RPSG and KDOS social media platforms have been encouraging integrative practice and pertinence of healthcare service user and healthcare service providers or patients and healthcare professionals co-developing efforts and co-developing efforts for some time. So that draws this audio podcast to a close. This audio podcast as part of the Serology and Squil. This audio podcast is part of a Hustle and Stereotype. This audio podcast is part of a Defcon premiere, and this audio podcast as part of a Storm Robotics production.